Okay, so I have Atrovent, and it is a bronchodilator that works to open airways in the lungs and make breathing easier. And the chemical in it is isotropium bromide. Its chemical formula is C20H30BrNO3. Its molecular weight is 412.368 grams per mole, and most of that is carbon, and it accounts for like 58% of the weight. It's a white crystalline substance when it's a powder, and when it's in liquid form, it is colorless. And it's soluble in water in most low alcohols, but it is not compatible with strong oxidizing agents. And the most common brand name is Atrovent, but there's also Atrovent and Epaxos. And so it's mainly used to treat bronchospasms and prevent symptoms of ongoing obstructive lung diseases such as COPD and asthma. And there weren't really any previously used alternatives because it was like the first long-term preventative that actually worked to prevent bronchospasm and keep the lung airways open. So albuterol and Spiriva were previously used, but they could only have short-term effects because they could open the airways, but they couldn't keep them open. And so how it works is it opens the bronchioles, which are little tubes in the airway that are surrounded with muscles called smooth muscle. And so when the smooth muscles tighten and constrict, they cause coughing, wheezing, and shortness of breath. And so you can use it with a nebulizer or an inhaler to take it and just prevent bronchospasm. And so it can be taken as an inhaler, a nasal spray, and nebulizers.
What's the little blue thing? What is the little blue thing? Oh. Is that for kids, I guess?
Yeah.
That's adorable.
So it was first developed in Germany in 1976, and it was approved for medical use in the U.S. in 1986, and now it is on the World Health Organization's list of essential medicines. And it's pretty cheap. A 200-dose inhaler costs about $6.60, and it can be found with some generic brands, but they aren't as effective. And so most people are prescribed to take it in 5 to 15-minute sessions every 4 to 6 hours. And the side effects are just the generic dry mouth, nausea, and constipation. And so for pharmacogenetics, dynamics. Isotropium bromide is used as a bronchodilator in the management of cholinergic-mediated bronchospasms that are associated with chronic obstructive pulmonary disease, COPD, asthma, and in the treatment of rhinorrhea that is associated with common colds, allergies, and seasonal rhinitis. And it does not significantly affect pupillary diameter, heart rate, or blood pressure. And when it's taken as a nasal spray, there is no alteration of physiologic nasal functions like smell. And for pharmacokinetics, it is obtained by combining is a quaternary amine that is not readily absorbed into the systematic circulation of the surface of the lungs or into the gastrointestinal tract. And studies on rats have shown that it does not penetrate the blood-brain barrier. And the half-life of elimination is about 2 hours after it is inhaled. And about 1/2 of the dose is passed through the urine unchanged from when it was first administered when it's taken intravenously. But that's not recommended. For mechanisms, the industrial synthesis route, it is obtained by combining atropine with isopropyl bromide. And atropine is an ester that is derived from the synthesis of tropic acid and tropine. And so the isopropyl bromide is combined with the atropine to form isotropium bromide. And it is an anticholinergic agent that blocks muscarinic cholinergic receptors and results in the formation of cyclic guanosine monophosphate, or CGMP. And the CGMP works on the intracellular calcium in the smooth muscle, and it it's what decreases the contractions of the smooth muscle around the bronchioles to keep the airways open so that breathing is easier.